There's one that you've shared with me quite recently that sort of incorporates a few different therapies. Particularly, there seemed to be a problem with surgery that this lady had, and an issue that involved the medical system as well. Let's just go through this one as quickly as we can, because we've got another 2 or 3 to do. But give the basics of this one and what you did to help this lady. Yeah,
we'll go quickly because this was 6 months of work doing various different modalities, and she had plenty going on. But this is a lady called Fiona, and she came to us and she described a situation. 5 years since she felt well, felt like herself and didn't have these symptoms. Over those 5 years, she'd had a lot of medical input. She'd been diagnosed with IBS, hiatus hernias, acid reflux, like severe acid reflux, and chronic ear infections. Her eustachian tube in her ear was inflamed. And her steps had been, and she was still on antihistamines to calm things down, and her responses to foods and stuff like that. She had a very restricted diet. Straight outside of that, flare-ups, medical enemas, medicines, so that without these medicines, she wouldn't be able to have a bowel movement. And the surgery that you're talking about was the surgery for a reflux, which was like the most debilitating symptom that she'd been experiencing. And the surgery that she undertook did actually fix the reflux. So that's why she had it. The surgeon said it would stop the reflux, and it did. It absolutely did.
Was it like a wrapping round of stomach tissue around the bottom of her esophagus or something?
Exactly that. It's called a Nissen Fundoplication reflux surgery.
Yeah. So always you cannot pronounce it.
Yeah, exactly.
Always seem to come up, the medical system comes up with drugs and procedures and surgeries and diagnosis that you need a PhD to pronounce, never mind understand.
I definitely didn't pronounce that correctly. But the surgeon can choose, probably based on the severity of it and the situation, they can choose how much of a wrap to do. And she had a 360-degree wrap, so all the way around. Couldn't have been more. And as you might imagine, structurally, it stopped anything going back up. Anything in a stomach could no longer reflux and go in the wrong direction. So no more digestive juices going back up, no more stomach acid, no more anything. So on one hand, solved. On the other hand, absolutely not solved, because it's got nothing to do really with the causation of why she was getting the acid reflux. It wasn't asking or answering those questions, why at all. Also, I suppose it just sort of led, because it didn't change anything maybe of the disease state that was going on, or the issue. She had a whole other set of symptoms, which is why she's now kind of contacting us. And because nothing could escape, even if you would just produce the normal amount of belching, burping, and gas, that would build up. That couldn't escape either. She could not burp. Okay? Yeah. And she had more than the average person's amount of burping, because she had plenty of digestive dysfunction going on. So anytime something did want to release, it couldn't, and it would build up pressure, and it was pretty agonizing pain for her. And she just had to see it out. This was a bit of an issue. What it also left her with was this very, very strange feeling of like having a tight muscle in your gut. Mm-hmm. So a bit like if you've got a tight muscle in your leg and you feel like you're going to pull it, and like in your hamstring or something like that.
Feel like you need to stretch it, but you sort of, you can't, because it's deep inside your viscera, really, the internal organs in some way.
Exactly. It basically led from probably where the surgery was, but her upper GI tract, down through her abdominals, almost to her pelvis. She felt like it was one line, one sort of bowstring, really, really tight there. Now, she didn't walk around hunched over, but subtle postural analysis and what she described, she was not upright. She was more comfortable in flexion, leaning forward, than she was actually being upright, and there was no way she was comfortable in reaching for things, arms overhead, or even bending over backwards kind of thing. This is not great just for general function, but she wanted to play sport again. She's a great athlete. She played basketball at a high level, and she wanted to get back to it. So there's no chance of doing that if you can't arch yourself or reach your arms above your head. So it just felt very, very tight, and she'd been experiencing that ever since the surgery. So we used bodywork, basically, structural integration technique. The technique I use is Bowen Technique, like you said earlier. This is very, in some simple terms, it's just working on the soft tissues of the body. You just do moves in specific places over muscles, tendons, ligaments, connective tissue like fascia and things like this. So we assessed her body and we did the body work to say we need to release off where the assessments tell us her greatest stresses on the body are, basically. Okay, simplifying it. But this body work was able to kind of unwind this tension. And every time we did the assessment, what was interesting, the assessment was not telling us to go and work on a stomach kind of thing, to go and work there. It was telling us every single time to work around the hips, around the lower back, around the pelvis, the bottom of the spine, like sacrum, coccyx. We did several sessions, and it was always that work. And every time we released off something that was causing tension and asymmetry and imbalance, poor alignment, she was moving better. She was starting to feel less of this discomfort, a posture changed and things. By the end, she didn't have any of this feeling at all. She's back to basketball, playing at a high level again, and doing all those agile, powerful kind of movements and stuff like that. And not just feeling good, but the confidence to move in ways as well.
And she pooped.
And she did. Yeah. I'm glad you mentioned that, because it's like there's this, when that happens, I think you get like a double whammy of an effect. Yes, you've got this, it's helped a particular symptom that you were feeling, and the tightness and the discomfort, that's great. But actually, how that reverberates around your body, and I suppose the quality of your life and your vitality, is the fascinating bit for me, because now she's standing more upright. Now she's created more space for those viscera. Now it's changed. Her lungs can open up. She's probably breathing properly now, because if anyone tries to breathe properly when you're just flexed, and then you straighten yourself up, you take that natural breath in, etc. Now, if she's breathing 22,000 times a day better, then that's just going to have a myriad of effects around the body. You could talk all day about how that would affect someone, but in particular, her bowel movement started moving as well, like you say, because that natural anatomical relationship between what your diaphragm does and where your gut is there by design, not randomly. It's now she's getting 22,000 massages around her gut, around her intestines, to just keep things moving. I'm sure there were other things that helped, but you're guaranteed that's getting her bowel movements going too.
Cool. And what happened with the ear problems? Did the ear problems clear up as well? Yeah,
absolutely. So her ear, the ears would flare up whenever her gut flared up. So she started to see the wood for the trees and see the connection, because before that it's just a haze. I always feel like this, and I always feel like that.
That's the chaos, right? That's a set of disorganized symptoms that seem chaotic to the person suffering. And as the investigations go and little tweaks and therapies kick in, people start to notice associations. As certain symptoms lift, they can now see, when that happens, this also happens. So they're actually connected. It's not chaotic and random. There's an association between what I'm doing, what I'm experiencing, and different things flashing up at the same time.
Yeah, exactly. And so she started to get that clarity. It's like when you start seeing, because sometimes you can theorize that and things, but when the light bulbs are there go off for the person and the client, that they're just taking more and more control, and they're connecting the dots, and they could take more responsibility for those results. So nothing will stop them, really. So her gut was a big player, I suppose, in what was going on with her ears, and she did not have a shortage of tests and stuff that the medical system had done for her ears and kind of help there, useful, but they weren't looking at the gut for a start. But we did. So we found some key things. There was inflammation there. So
was that through a stool test?
Yep.
Yep.
Comprehensive. When she came to me and we really, the first questions we were asking is, we don't know if we're going to be able to, we certainly can't help everybody anyway, but we might just say, this isn't for us. She actually came to me and she said, I feel like a 2 out of 10. So, which is usually a bit lower than what we would work with. That is a medical situation, as numbers go. But I asked her, what have you done and what have you not done? Kind of thing, so far over the last 5 years. And it turns out that she hadn't looked in the places that we would typically want to go and look and put the steps in place that we would typically want to put in place. So we thought there was quite a bit of value. So we did that comprehensive digestive health test, which doesn't just look for one thing or two things. It says, let's just see what we can find out. What pathogens are there? How well are you digesting? Is there any inflammation? What's your immune system doing? What's the toxicity potentially like? And so on. So the key findings we got is that she did actually have a fairly major stomach infection, digestive infection of a bacteria called H. pylori, of which you know a lot about and you've educated a ton about. So this bacteria can live in different places, but it's often in the stomach. Doesn't always cause acid reflux and heartburn and things, but typically can. So immediately we're thinking, is this, we don't know because we don't have a time machine, but is this what has caused the acid reflux in the first place? Yeah. Years before, and so on. So it's a really, really important thing. Either way, what we know now is it's there. And there was quite a lot of inflammation. So she put steps in place to do gut healing steps, balance the flora that are in there and the pathogens, and improve the ability to repair that tissue and improve her digestive capacity. Yeah. Which meant she was changing the sort of intrinsic part, her function. She was focusing on what her body needed and improving her function, which actually led to her ability to eat more foods without the same challenges. And even the foods that were causing these flare-ups weren't doing it as much. So ultimately that connection between the gut and the ear and those tissues just started to diminish that being a problematic relationship, basically.
Yeah, thanks for that. I think there's a couple of really important points there that are worth just stopping and pausing and emphasizing for our audience, which is, first of all, the gut is connected to many other parts of the body, if not all other parts of the body. And we're still surprised, even after many years of working, at certain things that can clear up when the gut is actually dealt with and healed. Ear problems, eye problems, problems in the feet, arthritic pains in the fingers, all sorts of things can clear up. Energy goes up, mood stabilizes, for reasons that we can't sort of go into technically. And the other one is, with this lady in particular, 5 years she wasn't feeling very well. And so over that 5 years, you think, right at the point where she started feeling unwell and she started having the reflux symptoms, if she'd been to see a visceral osteopath or somebody like yourself who does Bowen Technique, or, there are probably several disciplines that could have helped her. She'd maybe have done the stool test and found H. pylori. Would she have ever needed the surgery in the first place? Because you resolve the hernia with some gentle visceral manipulation. And if you find the H. pylori and knock that out and, expand her dietary intake and get the nutrients back into the body, it might be that surgery was never needed. But the problem is, the color of the spectacles that are being worn by the doctors and people in the medical system are only based on treat with drugs or do surgery. There's no gentle manipulation of the viscera. There's no full assessment of the GI tract. There's no assessment of nutritional status and stress levels and all these things that could be causing the initial problem in the first place. And so our job is not to battle against the medical system in that regard, is to educate people that, hang on, before you take drugs and do surgery, here are all the other options that might be helpful, that might help you avoid drugs and surgery if you don't want to go down that route. It may be that that's necessary in the end, but don't jump into that if you haven't thought about and tried some of these other really cool methods that are on offer to people from various practitioners and different schools of thought.